Hello everyone, welcome to USMLE case presentation on the cardiovascular system. Today we'll be looking at a case based on cardiac embryology. I'm Dr. Wahid Mohabir. I'm a PGY2 resident in Miami, Florida. I've taken all the STEP exams and you could use this video to aid in preparation of your exams. All right, let's look at the vignette. We have here a 24-year-old man presenting to the clinic with a history of chronic recurrent sinusitis, a productive cough that has persisted for several years. He states that he and his wife has been trying to conceive for over a year without success. On physical examination, the physician notes distinct heart sounds best heard on the right side of the chest, and a chest X-ray confirms that the cardiac apex is pointing towards the right, and the gas bubble is located on the right side of the abdomen. And let's look at our question. So, which of the following embryological events is the primary cause of the cardiac finding in this patient? A. Failure of the aortopulmonary septum to spiral, leftward looping of the primitive heart tube, failed migration of neural crest cells, incomplete fusion of the endocardial cushions, or E. Defective formation of the septum secundum. Uh, in order to answer this question, first you would need to know the diagnosis in that patient. So this point, you could take some time, pause the video if you wish, and lock in your answer. Alright, so the correct answer is B, leftward looping of the primitive heart tube. So if you chose that answer, you're correct. And if you thought the diagnosis was Carter-Jenner syndrome, then you're also correct. All right, so let's have a look what Carter-Jenner syndrome is. Um, so this patient in the vignette presented with a classic triad of the Carter-Jenner syndrome. This is a subset of primary ciliary dyskinesia. Uh, the syndrome is characterized by a triad consisting of chronic sinusitis, bronchiectasis, patients will have chronic cough, and situs inversus. So this includes dextrocardia, the heart being located on the right side, and abdominal organ reversal. In our vignette, you would note that the patient's gastric bubble was on the left instead of the right. Also note in our patient was trying to conceive, and this patient was likely um, having a defect in the sperm. So the syndrome is also characterized by um, immobility of the sperm tails, resulting in infertility in males. Alright, so here's a great chest X-ray showing what situs inversus and dextrocardia would look like. As you can see here, the cardiac shadow appears to be pointing towards the right side instead of normally where it should be on the left side. Also, you would note that the gastric bubble in this patient is located on the right side instead of the left side. Also, you would note it seems like this patient's liver is also located on the wrong side. Um, I say this because you could see the left hemidiaphragm is higher. Usually the right hemidiaphragm is higher because the liver would be present there. But if the liver is present on the left side, that hemidiaphragm would be higher. Alright, so let's review the embryology of dextrocardia and the Carter-Jenner syndrome. This is the stuff that you'll need to know for the exams. So let's look at normal physiology. During the fourth week of development, the primary heart tube would elongate within the pericardial sac. Because the tube grows faster than the sac, it must bend. Normally, cilia create a leftward flow of fluid, triggering a cascade that signals the heart tube to loop to the right. This is also known as delooping. This places the heart on the left side of the body. Later on, we'll look at this visually so you would get a better idea of what I'm talking about. Alright, so now let's look at what goes abnormal, resulting in dextrocardia. So, in this patient, a defect in the dianid arms of the cilia prevents normal ciliary motion. Without the directional flow, the heart tube loops randomly. If it loops to the left, which is also known as delooping, the heart develops as a mirror image of the normal heart, and that results in dextrocardia. And you'll see this visually shortly. So the significance of this clinically, when dextrocardia occurs with situs inversus, total organ reversal, like our patient had, the heart functions normally. However, if some patients would have isolated dextrocardia without the situs inversus, this is often associated with more severe cardiac abnormalities. Alright, so now let's look visually at this. So let's look at cardiac looping. So this is the heart tube here, and this is D looping, and this is L looping. And D looping is what normally should happen in us. So usually D looping would place when D looping occurs, it would place the heart on the left side of the body. If L looping occurs, then that would result in the heart being on the right side of the body. So D looping is normal, L looping is abnormal. And then finally, let's look at why the other answers are incorrect in this case. So A was failure of the aortopulmonary septum to spiral. This is incorrect because this error usually leads to transposition of the great vessels. C was incorrect, failed migration of neural crest cells. The neural crest cells, just as a review, crucial for formation of the conal truncal septum. Failure of migration typically leads to conotruncal abnormalities such as tetralogy of Fallot, truncus arteriosus, or transposition of great vessels. D is also incorrect, incomplete fusion of the endocardial cushions. The endocardial cushions separate the atria from the ventricles, and usually a defect in this would result in AV canal defects. E, defective formation of the septum secundum. A defect in that would lead to atrial septal defects. Alright, so this is the end of the video. If you like this video, give me a thumbs up. If you want to see more contents like this, please subscribe to my channel, and I'll see you in the next video. Bye bye.